I believed we were, but I thought I would check so I make sure I get through everything. So SHIBA is stands for Senior Health Insurance Benefit Advisors, but we're basically a resource that is available to everybody in Idaho to help people with their Medicare. We're funded by a federal association called the Administration for Community Living. We used to be funded by the Centers for Medicare, and they just adjusted how they do things. So we do receive a grant, and then we're also funded by the Idaho Department of Insurance. So I'm not associated with any brand or company or insurance agency at all. I'm not even legally allowed to be an agent and be a part of this program. So my interest is really educating you about Medicare. We are a nationwide program. There's programs like ours in every state. So if you are from another state and got in here somehow, that's okay. A lot of what I'm talking about is going to be the national federal Medicare program. So that's totally fine. Washington, if you're from Washington, they have a great program also called SHIBA, and we work very closely with them. We are normally housed in various agencies. In Idaho and Washington, we're housed under the Department of Insurance. Every state does it just a little bit differently, but we offer the same services. So we're going to talk about getting started with Medicare if you're turning 65 or disabled. And again, I'm going to talk a little bit about the open enrollment period right now. We're going to talk about, well, we offer information as well on Medigap, Medicare Advantage, Medicare prescription drug plans. We also help people apply for Medicaid programs. We help people get help with their Medicare costs, understanding medical bills. A lot of what we do is appeals and grievances. So if your private plan or your federal plan, your A and B, don't pay for some reason, we can help with all of that. We also help people evaluate long-term care insurance. Just touching on the Medicare and You book, if you're on Medicare, you should have received it. I hear every year from lots of people who don't for some reason. I'm never sure 100% why. But this is mailed each fall. So you should have already gotten it because they started to go out in September. And then it's a good quick comparison. The one we get is specific for Idaho, so that's obviously helpful. And then there's specific county information on the back of in all of these books. It isn't hugely comprehensive, but it's a good starting point for people. So some of the helpful links that are in the Medicare and You book, I like to just give this out. And then have given this presentation to Karen, and she'll be distributing that as well so that you have this information at your fingertips. Some of the places where you can go to look at some different things, some links is the Medicare.gov Plan Finder, the electronic Medicare and You handbook. I'm always using that. And then 1-800-Medicare is great because they are 24/7 right now. So any time of day, if you just feel like working on your Medicare over a weekend, you can call them or in the evenings. And then Idaho SHIBA, our phone number is listed. A lot of times when you call 1-800-Medicare, they're going to refer you to your Idaho SHIP program, which is us. A lot of times they're going to refer you to that. So I have to touch on, just because we're all in COVID world, if you're already on Medicare, just a little bit of information. COVID testing is covered by your Part B, and you don't pay any type of copays as long as the doctor, pharmacy, or laboratory is a Medicare participating provider. There's lots of different ways that they do COVID tests. Like, for example, here in Kootenai County, they only do them at the hospital. They just do it different kind of in every county based on the health district. Even with a Medicare Advantage plan, they're not going to charge you copay, deductible, anything like that. They want people to be able to get tested if necessary. One of the things that the COVID did, which is a positive, is it really expanded the telehealth services, which is really, I think, great. And the doctors that I have talked to have found it really great as well. So basically, this is basically a quick doctor's visit you can do. As you can see, kind of in this picture, it's a gal on an iPad, but you can do it on your phone. You can do it on your computer. And then they've also waived the video requirements so that you could use audio only, which is helpful. I know my doctor's office, for example, I needed a refill on a prescription. It was the year, where you have to go in annually. And they said, and I called to make an appointment, and they said, oh, we'll just do a telehealth visit. It was very convenient because I didn't have to leave my home. I didn't have to take time off work. It was really brief and quick. And, it was something that was really easy for the provider to just, re-prescribe that medicine. But I think this is really helpful, and especially in the rural areas, especially where we don't have a lot of primary care providers. If you need a doctor's appointment and you can't wait, 3 months to get in, this is an opportunity for, especially if you need a prescription refill or if it's something you've had before, or, you just know what's going on. It's something that I think is going to really expand, and it's going to be really helpful. You obviously there's lots of different ways you can. A lot of your own providers probably are offering this, and they do it through, for example, they'll send you a link via text or email, and you just click on the link, and then just very much like you did this Zoom meeting, you put in a passcode, and you're there. So they obviously have a lot of restrictions to make sure your information's protected and things like that, but there's definitely some benefits to it, and that got kind of moved along really quickly for us. So that was really great. One of the new things that came out this year, and I won't talk a lot about this right at the moment, but this is something that the Trump administration came out with earlier in the year, and it's the Senior Savings Program. It's an insulin savings program. And you may not realize how expensive insulin is and how important it is, but a lot of people, insulin can be very expensive. And this has allowed some Part D plans and Medicare Advantage plans to have a maximum copay of $35 for a 30-day supply. And the reason that's really great, I think, is because there's so many people that are on insulin and can't afford it. So they're making their insulin stretch, not taking really the dosage that they need. Then they end up in the hospital, and it's this horrible vicious cycle. And it's unfortunate, but in all reality, it costs the healthcare system a lot more money because those hospital stays can be so expensive. So this is a great thing. This is the first year it's come out, and it will be 2021. So if you're on insulin, double check your plan and see if this is something that will help you. There's no income requirements with this. This is just available um, to anybody with a Part D or Medicare Advantage plan. Not all the Medicare Advantage plans offer them, but I would say about a third of the Medicare Part D standalone plans are offering this. So I have another slide that just has a few more details on it. But as you can see, like a lot of the Part D plans will have that deductible. Well, a lot of people just don't have that $400 in January to cover their insulin. And then they go into the coverage gap fairly quickly. And then they're paying, like $125. That's a lot of money to pay for a medicine. And as you can see with this model, it just gives you the $35, all year long. So I think that's great. It's one of the things I like to tell people about. So I want to touch on the Medicare open enrollment period. If you're seeing a ton of advertising, even from the Health and Human Services, the federal program, and the Centers for Medicare, and private companies, I'm working remotely today, and I just sometimes have the TV on in the background and have it on mute. And I cannot tell you, every time I looked up today, there were so many advertisements. So if you ever have your TV on, trust me, you will see them. But this is the time from October 15th to December 7th that you have the opportunity to review your Part D plan or your Medicare Advantage plan. And that is going to change or keep your coverage the same for the 2021 year. So it's very, very, very important that folks take this opportunity to review their plan. It could be that the same plan is going to be great for you for next year, but it also could be that the pharmacy you've always went to isn't going to be in network anymore. And you may want to stay with that pharmacy and find a plan that's going to be in network with that pharmacy. And so that's a big thing. And we love to help people determine if their current plan is going to be good for them the rest of the year for the following year. So it's a great opportunity to review that. And you don't really have the opportunity if you're in Medicare after December 7th. So that's a big deal. Just to highlight, during this open enrollment period, you can join or change Medicare prescription drug plans. That's the Part D. You can join or change a Medicare Advantage plan. You can leave your Medicare Advantage plan and return to original Medicare. And then just take the time to review and compare your health and drug plan choices for the following year. If you're in a Medicare supplement, they don't have an annual open enrollment period. And I'll talk a little bit more about that, but I get lots of calls on that. And I don't mind getting the calls because I know that then people are, paying attention and they know it's the open enrollment period. And, what does this time mean? What can I change? So the Medigap and or supplement is the same thing. And if you don't have any idea what I'm talking about, that's okay. We're going to be talking about that a lot. The Medigap, Medicare supplement, they are the same thing. That doesn't have an annual open enrollment period. Those are just structured differently. But if you have a Part D plan with it, this is the time that you can review that. So I like to use this chart because you have different ways to get your Medicare. And this chart, I'm going to provide you with a fold out of this, but this is just great. This really tells you your different roads you can go down to get your Medicare. So I'm going to start with the original Medicare. You have different ways when you start out on Medicare to get your Medicare. You can take Part A and Part B, which is considered original Medicare, and you can add things to it. So you can add prescription drug coverage because A and B does not cover prescription drug plan, doesn't cover anything you would normally get, most of the things you would get at a pharmacy. And then if you want to, you also have the opportunity to add supplement coverage. And as you can see, it says Medicare Supplement Insurance Medigap. So that's your original Medicare. So in this situation, your A and B would be your primary insurance, and then you can add things to it. Or you can take a Medicare Advantage plan, which combines your Part A, B, D together into one plan. And I am going to be referring back to this chart quite often in my upcoming slides when we really dive into the nitty-gritty of A, B, and Medicare Advantage plans and D. But this kind of gives you a basis. The biggest thing to get from this slide is just that there's different avenues to go down to get your Medicare. You can take original Medicare and add things to it, or you can combine everything together into a Medicare Advantage plan. So Karen, are we doing, if I don't hear you, I will just keep going, but if there's any questions, feel free to interrupt me.
We're just going. We do have one question, but she said that we can wait until question answered. Do you want to take it now or later?
I'm sure most of the time when people have questions, I love it because probably other people in the group have the same question. So go for it.
Okay, well, her question is, how does somebody find out what plan they are currently on?
Perfect. Great question. To find out what plan you're currently on, you can create a Medicare.gov account through the federal website. It's fairly easy. It's a lot easier than creating the SSA.gov account because it doesn't include your social security number, which is great. And that I'm going to talk about here coming up. So it's a great question. You can also call us and we can help you create that account as well. Or you can call 1-800-Medicare. So you have a couple different options there. So I'm comparing them just like I did on this slide as I did on the previous slide. And like I said, I'm going to kind of refer back to this. So I'm going to be going down these two avenues here. So on the original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. In most cases, you don't need a referral to see a specialist. It doesn't matter. You can go to, like I said, any doctor. If you're traveling, you just go to a doctor that takes Medicare. It's like traditional healthcare. It's not managed care. And on the other side, Medicare Advantage plan, you'll need to use doctors or other providers who are in the plan's network and service area. Some plans will not even cover care if you're outside the plan's network. So these are HMOs, which are health maintenance organizations, or PPOs, which are preferred provider organizations. So they're just structured a little bit differently. And we're going to talk about the pros and the cons and the differences as we go on. Most of the plans, or all the plans in Idaho, you really do not need to get a referral to see a specialist, which is good. But it's kind of like you may have had a PPO, preferred provider. That's where companies contract with different providers, and then HMOs are health maintenance organizations, and they plans then contract with health organizations, not necessarily specific each individual doctor. And then again, just going down that same chart, original Medicare covers most medically services necessary. Definitely hospitals, doctor office visits, and other healthcare settings. Original Medicare, so your A and B, isn't going to cover benefits like eye exams, dental care, and some other routine exams. When it says see page 51, that's in your Medicare new book. The Medicare Advantage plan must cover all the medically necessary services that original Medicare offers, but it does offer extra benefits that original Medicare doesn't cover. And these Medicare Advantage plans are becoming more and more attractive every year. This year, a lot of the plans are offering preventative and comprehensive dental up to a certain dollar amount per year. And then they're also offering, very discounted hearing aids, routine vision, glasses, things like that. So that's really, I think, one of the benefits of the Medicare Advantage plans. It kind of puts everything into one plan. With the original Medicare, if you want drug coverage, you do have to get separate Part D coverage. The Part D is included in your Medicare Advantage plan. If you get your prescriptions from the VA or something like that, then you don't necessarily have to take a Part D. Again, in most cases with your original Medicare, you don't have to get anything approved ahead of time. Some major things you do, but in most cases you don't. With the Medicare Advantage plans, a lot of times they do require pre-approvals to get a service or supply approved ahead of time. So they're a little more restrictive in some ways. As far as travel goes, original Medicare usually does not cover care outside of the US. And I'm going to talk about, again, Medicaps and Medicare supplement policies that would cover care outside the US. And the Medicare Advantage plans generally do not provide care outside of the United States. One of the things I tell people when they're looking at their options and trying to decide if they want to go down the original Medicare route or they want to take a Medicare Advantage plan, I usually ask them how often they travel. If they, travel a lot of times people maybe go to Arizona, Florida, they have family that they spend part of the year with. Usually in that situation, original Medicare is going to be possibly a better option for you. It's going to be more portable. Your Medicare Advantage plan, you have to buy a plan in your service area. So that's based on county. So depending on the county you live in, they get more, the bigger the county, the more Medicare beneficiaries, the more options you have, the more companies do business in that area. So for an example, if you're in Cooney County, you have more options than you would in Latah County. If you're in Spokane County, you would have more options than you do in Kootenai County. So the bigger the area, the more Medicare Advantage plans that do business in that area. And the reason that is because there's more providers, more hospitals, more specialists, things like that. So it's a little bit easier or a little bit more flexible for Medicare Advantage plans to have plans in that area. There are some counties that are not highly populated. We do have a lot of that in Idaho that offer no Medicare Advantage plans. And so that gets a little tricky for people and sometimes frustrating. But Latah County, Shoshone, most of the counties in Region 1 do offer Medicare Advantage plans other than Benoit. They're a smaller county, don't have, a lot of providers, things like that. So it makes it difficult for plans to do business in that county. So I'm going to, again, just talk about Part A. And this is just original Medicare. So your Part A, most people get Part A premium free, sort of course. That's if you've paid FICA taxes for at least 10 years. So premium free is kind of like prepaid. You don't necessarily get it free. You've been paying for it for years. So a portion of your FICA taxes goes into the Part A account. And so you do get that premium free. A lot of times, if you haven't worked for 10 years or paid FICA taxes because you were maybe self-employed or another employer who doesn't pay into it, you could borrow quarters from your spouse. So a lot of times, not so much anymore, but in sometimes we have people retiring and they maybe were, took care of the kids for years, didn't work outside the home, or were self-employed and they didn't pay into the Part A. So in that case, then, if they were married a certain amount of time, then they can use quarters from their spouse. They also, if you haven't paid taxes, FICA taxes for over 10 years, you can still get Part A, but it's going to be, there's going to be a premium for it that you pay every month. I don't really ever run into this that folks pay a penalty if they don't get it when they're first eligible. Most people, if they don't take Medicare Part A, it's because they have group coverage. And so they don't really run into that situation a lot. But there could be penalties if you don't take it when you're eligible for it and you don't have any other coverage. So as far as Part A is going to cover you in the hospital. Part A is only going to cover you if you are, it's going to cover a couple of things. It's going to cover you if you're an admitted patient and if you need to go to rehab, to a skilled nursing facility. And it's going to cover blood transfusions and sometimes a little bit of home health. But primarily, it's only going to pay for you if you are an inpatient in a hospital. So I'll give you a couple examples. So if you go to the emergency room just for some service and you get discharged that day and you don't get admitted into the hospital, that's not going to be covered by your Part A. If you get an outpatient surgery, that's also not going to cover under Part A. Part A is going to cover you if you're an inpatient in the hospital. So you can't even be in, even if I was to spend the night in the hospital, I'd say, well, I'm in the hospital. But that's not necessarily the case with Medicare Part A. You have to be an admitted patient. You can't be under observation. You can't just be in the emergency room. It's definitely an admitted patient. And the hospital, if you're on Medicare, is required to give you documentation and let you know if you are not an admitted patient and what that means. So what happens, and the numbers I just checked today have not come out yet officially for 2021, but if you have Part A and you're hospitalized, what Medicare Part A is going to cover is after you pay a $1,408 deductible for each benefit period, then Medicare is going to cover that hospital stay. So let me give you another type of example. So if you're hospitalized and let's say you're on Medicare all of 2020, and you were to be admitted into the hospital on January 2nd, and then you were to be discharged January 5th, you would have that one hospital stay, and your deductible with Medicare would be $1,408. If you were hospitalized 60 days later, so let's say in that same example, then you were hospitalized again on May 1st, so it's been over 60 days, Medicare is going to charge you another deductible. Medicare has a deductible on Part A every 60 days. So, in that same example where you got discharged on January 5th, if you went back on January 30th, you would still be in that same benefit period. Usually, when we talk about deductibles, it's annually, but the Part A is not set up that way. So, as you can see, it's for the first 60 days consecutively in a hospital, you would pay that deductible. After you're discharged and out of the hospital for 60 days, then that's where the deductible comes in. And again, keep in mind, I'm just talking about Part A without a supplement with it or having a Medicare Advantage plan. It's just strictly the Part A right now. So that just kind of, whoops, got ahead of myself, hit an extra button here. So that's kind of your Part A. The Part B, I feel like I jumped way ahead, but maybe not. No? Okay. So your Part B is going to be your Part B medical insurance. So it's going to cover your outpatient hospital, your emergency room. It's going to cover your doctor visits, labs, x-rays, anything outpatient. It's going to cover you. Durable medical equipment, wheelchairs, oxygen, hospital beds, things like that. That's going to come under your Part B. In 2020, that premium for most people is $144.60. If your income in 2018, and they're looking at your adjusted gross income, was quite a bit higher, and this is in your Medicare and U book, and I'm happy to provide it to you as well if you're interested. If your income is higher, I want to say around 88,000, almost, sorry, I'm going to back up 77,000 for a single individual, and then it's close to double that for a married couple. Your adjusted gross income is a little bit higher, then you're going to pay more for your Part B until you file your taxes for 2000. In 2021, they'll be looking at your 2019 taxes. They're 2 years behind because just how we file taxes. Nobody has filed for 2020 yet. And then, for 2019, that's just then been filed in the last 6 months in many situations. But again, you can have a higher premium, but that will go down again as your income goes down when you file your taxes each year. Premiums are normally deducted from your Social Security, but that's okay if you're not on Social Security and you're on Part B. They find another way to get your premium from you as well. There can be a penalty if you don't buy your Part B when you're first eligible. And I want to be clear in this situation because a lot of people feel like, oh my gosh, I've just got to take my A and B right now. And they have employer group coverage. If your employer group coverage pays secondary to Medicare, it is considered credible healthcare coverage from you or your spouse's active employment. You don't need to take Part B in most situations. If you work for a really small employer, that's different. And like I said, I can always chat with you about your specific situation, but some people don't, some people take Part B before they need to. And really, it doesn't do them any good because it pays secondary. So your employer coverage is going to be the primary. So you're just really paying for something you really don't need in most situations. But I always advise people to go ahead and double check that for your specific situation. But don't just take it, adversarially. Definitely look into that if you're just becoming eligible for Medicare. I don't want to see anybody waste their money, of course. So we're going to talk about the Part B costs. So as I had mentioned in Part A, the benefit period and the deductibles are structured a little different than we're used to. With Part B, it's structured completely different, just to throw everybody off. There is an annual deductible in 2020 of $198. And then Medicare is going to pay 20% for most services. So this is, again, going to be your doctor services, lab, ambulance, diagnostic, anything outpatient. That's when your Part B is going to come into play. I believe this deductible will be going slightly up for 2021. I don't see it going up a lot, but I don't have the official numbers yet. Also, on your Part B premium, which I'll jump back a couple slides here. Again, this is for 2020. Again, this isn't official information because it hasn't been issued yet, but I believe the premium is going to be for Part B in 2021. I believe it's going to be still less than just under $150. I think it's going to be around 148. That should be announced early next week officially. And so we'll have that information and you'll be seeing it if you go to the Social Security website or the Medicare.gov website. But officially not announced yet, but I don't think it's going up much. And what happens is this Part B premium does go up annually normally. But I'll give you an example. When I first started in this business, it's been about close to 13 years. The premium was about $99, maybe 96, but it's gone up gradually over the last 13 years. But the only way we can keep the Medicare Part B paying claims is to increase the cost sharing. You do pay for it through your FICA taxes as well. So you're paying into it still every time you pay FICA taxes. But again, it does grow, and I know that's difficult, but it's the only way because healthcare costs just keep going up, as we know. So you can see that premium rising a little bit, usually around the same amount. Unfortunately, the same amount is your Social Security cost of living increase. So
And
then you don't end up getting a raise. Yeah, go right ahead.
we have a couple questions, and so
You bet.
and I can probably answer this one, but since you're here, I'll let you.
Sure, sure.
So, is that 144 a yearly fee or a monthly fee?
Great question. That is a monthly fee.
And then,
That's a premium monthly.
yeah, and then we do have one other question that goes back a little ways, but
Okay. Yeah.
and I'm sure that you're going to talk about how people enroll in Medicare and everything. But what about people that are not quite 65 yet? How do they enroll and when?
Great question. So, yeah, let me touch on that. So, if you're not 65 and you're not collecting Social Security, you can enroll up to 3 months before your 65th birthday. So, if you're going to be 65 in March, let's just say March 15th, you have the months of December, January, and February to enroll in A and B. The easiest way to do that, and again, this is only if you're not receiving, because you can receive Social Security earlier than 65 if you're on early retirement through Social Security. You can receive it at 62. So if you're collecting a Social Security payment every month, they will automatically enroll you. And I know people who are eligible in February and March have already gotten their cards. So you get them about little over 3 months early. But if you are not collecting Social Security, you can enroll in A and B up to 3 months before, and then it would start the first month of your birthday. So if your birthday was March 15th, it would start March 1st. And the easiest way to do that is on the ssa.gov website. And I believe I'm going to reference that here in a couple minutes, but I want to make sure you get that down. It's the Social Security Administration website, and you do have to create an account, but it's fairly simple. You have to jump through a couple of hoops because they want to verify it's you. But that is a way, and that is usually the best way. Now, if you have trouble and you're unable to set up an account, right now the Social Security offices are not taking in-person appointments or in-person walk-ins at all. So the only way you can do it is either by mail or by online or by calling, and then I think they'll send you the forms. Now, you can get the forms online as well without creating an account. So again, you can do it up to 3 months before your birthday, the month of your birthday, and 3 months after. So again, if your birthday is in March, you would have December, January, February, the month of March, April, May, and June to sign up for Part A and or Part B. And then if you sign up, for example, in March, then your coverage for Part B would begin. It kind of is a month or two not retroactive. Your Part A can go back retroactive, but your Part B will not be retroactive. So if you want your coverage to start the first day of the month of your birthday, you want to make sure you apply for it plenty early enough. So, definitely if your birthday was in March, you would want to apply for it no later than February 1st, just to make sure that it gets started by March 1st. The only trick part of this is if your birthday is on the first day of the month, then your Medicare can start a month early. I guess I kind of think that's fair because if your birthday is March 31st, it still can start on March 1st. But if you delay, so if you wait until to sign up for your Part A and B until, let's say, April, then you're going to have like a 2-month wait until your coverage starts. So it won't start in that case until like June 1st. So they encourage you to enroll early so that that coverage gets started right when you're eligible. And again, if you're receiving any type of Social Security check, they will automatically enroll you and they will send you a welcome package. But of course, I know how much mail we get and how much mail you're getting at this time. And so there's always a possibility you miss that. So if for some reason you're eligible for Medicare and you're getting Social Security and you didn't enroll, then that's when you give us a call, you give Social Security a call because if you accidentally threw away that card, we need to get you another one. So I hope that that answers your question. But if you have more, please feel free to ask me. There are programs available that I like to touch on because that $144, that can get expensive. There are programs to help people pay for that. So I just like to highlight that if you know somebody who's having a hard time with that. So I want to talk about things we add to our original Medicare. Medigaps, Medicare supplements, they are the same thing. There's just two different terms for them. So I probably will interchange those words. So these are plans that help fill the gaps. So we talked about that 20%. We talked about the Part B 20%. We talked about the Part B deductible. We talked about the Part A deductible. That can be expensive. One of the things with your Part A and your Part B is there's no maximum out of pocket. So, for example, that deductible just keeps, if you have multiple deductibles, there's no ceiling you hit. So, there's not like a max out of pocket of $10,000 or $5,000 where they say, okay, you've spent enough of your own money. We're just going to cover you for the rest of the year. Original Medicare does not have that protection. So, a lot of times people, if they have original Medicare and they want to stay down that avenue, of their options to how they receive Medicare, they decide to add on a secondary insurance such as a Medigap, Medicare supplement. So we're going to talk about that a little bit. There's standardized plans. There's plans A through N. The most common plan a lot of people have still is the plan F. And that is the most comprehensive plan that was available up until January 1 of 2020. If you have the F plan, nothing's going to change. You're going to continue having it. But if you're new to Medicare after January 1, 2020, the most comprehensive plan you can buy is the G plan. Let me tell you a little bit about the difference between the F and the G plan. The only difference between the F and the G is this. Oh, I can't highlight stuff on this. Is the Part B deductible. And if you recall, the Part B deductible again for 2020 is $198. So the only thing it's not going to cover if you had the G plan is that Part B deductible. And then all your health care costs, not including your drugs, is going to be covered at 100%. Very comprehensive. If you have the F plan, that's the one spot where the F plan does cover the Part B deductible. So again, the Plan C and the Plan F are not available to those who are eligible for Medicare after January 1, 2020. A lot of people were really upset about that, but I don't think I'm showing you the rate sheets today, and that's okay. But the rate between the F and the G plan is usually enough to where it's in your interest to take the G plan instead of the F anyway, because you're going to spend about $300 more a year to have the F plan than you would for the G plan. And again, the deductible is only $198. Of course, that deductible does normally increase a few dollars annually, but it's not the end of the world just to have that Part B deductible because you're spending less in your monthly premium every month. And that's it. Why the federal government did that. It's a lot of different laws and rules and regulation, but basically they determined, and this was back in 2015, that they didn't want people, and you're paying for it. So I can't get mad at me. This is what the lawmakers chose, that they wanted people to have a little bit of bite out of their own health care, meaning a type of copay or deductible they paid. So they didn't eliminate, but they stopped offering legally the C and the F plan for individuals that are eligible for Medicare after January 1, 2020. So if you were eligible for Medicare last year and you took your A but not your B because you have employer coverage, you could still get the F plan. I would probably encourage you to definitely highly encourage you to look at the G, like I said, because that Part B deductible is going to be less than the premium. It's about, let's say it's $30 more for an F plan than it is for a G plan. That premium, over 12 months, that extra $30, that would be $360. So really to pay the G premium, you would still save, over $160 in that scenario. So I would probably still encourage you to look at a G plan, just because it'll save you money, and that's really all I care about is saving people money. There's other plans available. There's 10 standardized plans available, and as you can see, they're A through N, and these are different than Part A, Part B, Part D, because these are Plan A through N. So these are secondary to your original Medicare. They don't work without Medicare. They don't work with Medicare Advantage plans. They only work with original Medicare. So I'm going to talk about this a little bit. The best time to buy a Medigap is really when you're 65 years or older and enrolled in Part B. Or if there's anybody on here that is on Social Security disability and getting on Medicare, you have a 6-month open window when you first go on Part A and B, as a Social Security disability beneficiary. In Idaho, you have that. A lot of states don't, so I'm really proud that we do offer that for people with a no medical underwriting. That's fairly new, so it's a great thing. Your Medigap open enrollment period begins when you're 65 or older and enrolled in Part B. It lasts 6 months. Companies must sell you a plan. So that means there's no health question underwriting. The only legal questions they can ask you is your age and your smoker or non-smoker. It doesn't, obviously they can ask you if you're male or female, but that will not affect your rate. The rates are just based on the age you're starting on the Medicare. Example, if you're 65 and starting on Medicare, your rate might be a little less than if you're 70 and starting on Medicare, because you're a little bit older, and as you get older, statistics are, saying that you're probably going to have more healthcare needs. So the best time to buy the Medigap is when you're initially eligible and that open enrollment period. So if you're 70 and just retiring, your open enrollment period will begin when you take that Part B. And then, of course, it will last that first 6 months. other than that open enrollment period, or you can also buy one, for example, if you had a plan, a Medicare Advantage plan, and that plan just pulled out of Idaho, pulled out of your county, they're not offering healthcare in your area anymore, or they don't follow Medicare rules and Medicare determines that, hey, you guys can't do, business anymore, then you would get another opportunity to buy one, a Medigap. But normally it's going to be during that initial enrollment period, because that open enrollment period is going to open up all the windows to you to buy any Medigap sold in the state. And then it's just going to move with you. So they're very portable. So if you move to California, you move to Colorado, you move to Washington, that Medigap is just going to move right with you, because it's just going to be it's going to act as secondary. So any provider who takes Medicare is going to take that secondary insurance, regardless of where you live in the United States. Sometimes people choose to buy a Medigap. For example, let's say you've been on Medicare for a couple of years, and there's another plan and it's significantly cheaper, and you can save, $50 a month or whatever the case is. You can buy a plan then, but there will be medical underwriting. The plan can refuse to sell you the plan, and there can be higher premiums. There's no law saying that they have to sell you one. So this is very different than your Part D or your Medicare Advantage. This period is very different. That's why it's great to get this education when you're just going on Medicare, so you know what all of your options are right when you go on Medicare. So I know I said a lot there. So if you have any questions, don't hesitate to ask. We're going to touch on it a little bit more as we go through here. But that's your A, B, and then adding a secondary to it. And then I'm going to move to drug plans next, because what I've just talked about, your A and B are not going to cover any prescription drugs. So then you have to decide if you want to add a Part D plan along with your A and B. So I'll just take a quick minute. If there's any questions, Karen, feel free to let me know. So Part D plans came about in 2006. So they're available to everybody with Medicare, and they are available through standalone Part D plans or combined with your Medicare Advantage plan. So your Medicare supplement's not going to normally cover your standard Medicare supplement's not going to cover your prescriptions. And then if you have a Medicare Advantage plan, you would have to take the drug plan available with the plan combined together if you wanted the Part D coverage. So it's something to be aware of. It is available, and it's available to people. If you don't take one when you're initially eligible, that's okay too. You might have other coverage, but if you don't have coverage from either, VA, a retirement plan, a group health plan, you can buy Part D later during this open enrollment time, but you would pay a higher premium with it if you don't. It's called a late enrollment penalty if you don't have credible drug coverage up to that point and you're eligible for Part D. So I'll give you a little example. You go on Medicare when you're 65 and you don't take any prescriptions. So why in the heck would you want to pay for a Part D plan? I hear you. I wouldn't want to either. I understand that. But insurance is one of those things, regardless of what kind of insurance we're talking about, it's a risk and balance. So it's kind of one of those things where you take it in case you need it. Homeowners insurance, we hope to never use it, but we certainly can't buy it after our house is burnt down or we need to file a claim. If you don't have homeowners insurance and then you go to buy homeowners insurance, you're probably going to pay more for it. And the reason that is because you're higher risk, basically. So if you turn 65 and you don't take drug coverage because whatever reason, and that's okay, and you don't have other credible coverage, then if you go to take it when you're 68, you're going to pay a little bit more for your drug coverage. And the reason is because the only way private insurance companies stay in business and can cover the people that are using the services is by people being on the coverage that don't use it. It's a sad it's a sad situation, but that's how auto insurance works. That's how every insurance works. So they have to have more people on the plan than are filing claims. And that's the only way we can keep competitive companies, private companies, to continue to do business with Medicare. We can't force companies to offer, and Part Ds are only offered by private companies. So legally, there's no way we can just say, well, you have to offer Part D plans. But we need Part D, we need private companies to be profitable. There's lots of limitations on how profitable they can be, but we want to have lots of different options for Medicare participants. We have a lot of options in Idaho. If I'm talking to somebody and they take very inexpensive prescriptions and they are using, we look at what pharmacy they use. This year, there's a prescription plan available for 2021 that's as low as $7. It's a little over $7, but that's pretty inexpensive. The Part D late enrollment penalty is 1% for every month you didn't have it. So if you didn't have it for a year, the national Part D premium is about I want to say about $33. So you're going to pay 1% of that, which is 33 cents for every month you didn't have it. So if you didn't have it for a full year, you would be looking at about a little over a $3 per month late enrollment penalty. But that's every month as long as you're on Medicare. So that can add up. If you're not on it for a couple years, you're looking at $6. But as you can see, that it just keeps progressing. And then the problem is you can't just enroll in Part D whenever you want. You can only enroll in it during this open enrollment period every year, October 15th through December 7th. Unless you're new to Medicare or you're losing coverage through a retirement policy, a group coverage, VA, something like that, then you would have a special enrollment period and you won't be subject to the penalty. So, this keeps jumping ahead for me. So again, just to highlight what I just said, Part D is optional, but if you don't choose Part D when you're first eligible, you may have to pay a penalty later. Each plan has a different formulary. So there's 28 different standalone drug plans. The plan your wife has might be completely not the best plan for you because you might take different prescriptions. It all depends on the pharmacy you use and the prescription drugs you take. And like I said, we have plans from $7 to, probably around $90. I don't see a lot of people on that $90 plan because usually there's another plan that'll work for them that's less expensive. They have different deductibles. The max the deductible can be in 2021 is $445. And many drugs are not subject to the deductible. So if you use an in-network pharmacy and you're taking many generic prescriptions or some lower cost brand name prescriptions, you're not going to be subject to that deductible. Every plan has different formularies. You can go through the book and do the math and do all that, but I'll tell you what works. And the only way I'll do it, without reading all of that, is Medicare.gov. And we're happy to walk you through that and help you, walk you through that, look at it for you, provide you with options on what might work best for you if you're new to Medicare or for the 2021 year. So just to highlight some of the changes in the Part D plans from 2020 to 2021 is the max deductible went from $435 per year to $445. A lot of prescriptions are not subject to the deductible. Oh, here we go. I'm telling you, we have 28 and the premiums are anywhere from $7.30 to $123. So that's big. That's a big difference. Choose your plan based on the lowest annual costs with the deductible. So I really look at the full year. We look at the full year for you and we're like, okay. So for example, I'll tell you today, I was working with a gal and she was on a fairly inexpensive plan for 2020, but there was another plan available for her and it was going to save her $180 in 2021. And then her husband was also going to save $120. And it, you know, different company, you're going to make your payment to a different company, but gosh, they're going to save, $240, switching companies. So heck, why not? This plan had the same star rating. Um, no issues as far as that goes. So no issues with the pharmacy they use, no issues. So she just said, yes, go ahead and enroll me. But, I love that because heck, why spend more money if you don't need to? So it's a great idea, again, during this open enrollment period to review your plan. And any questions, Karen?
There's just one. Can
Perfect.
can you hear me? My mic started doing something weird. So actually, I got a couple questions. So
Perfect.
this one is the automatic enrollment into, I'm thinking she means Part A and not Plan A. So
Okay.
Part A is automatic, correct?
It's not. If you're not on Social Security, they will not automatically enroll you.
That's what I thought.
They don't assume you want it. So if you want Medicare and you're not receiving Social Security, you have to take action to get it. It is not automatic unless you're receiving Social Security. And if you're receiving Social Security, they're going to enroll you in both A and B. If you don't need Part B or don't want Part B, it's up to you to decline it.
That is correct. Okay. Okay, next question is, will my spouse's group plan insurance be treated like my primary insurance instead of Medicare Part B?
So as long as it's an employer that has over 20 employees on the plan, so if it's a very small group plan, then Medicare would become your primary. But if it's over 20 employees, and you can always ask the benefits what they're considered, if you're right on the edge there. But yes, it will act. Medicare will be your secondary, and your primary will be the group coverage. So in that situation, you probably will only want to take Part A because that Part B is most likely never going to do anything for you while you're on that group coverage. It's just going to sit there and you're going to continue to make that premium every month. So and you can decline. I mean, if you've taken it and you've figured, if you're just learning about it, that's okay. You can decline. You can now decline. You can decline your Part B going forward. And if you need help with that, I'm happy to assist you. But if you have a group coverage through you or your spouse's active employment, then you're not going to incur late fees. You're not going to incur a late enrollment penalty. When that coverage is ending due to retirement, then you're going to have a special enrollment to enroll in Part B.
So Angie, with that too, this kind of touches on another question that I did answer earlier, and it was, do you have to enroll 3 months before turning 65, even if you are still insured under the employer? And I asked them if they would still be working after 65. So they do want to enroll in Part A, correct? Even if once they turn 65, even if they're still employed?
This is always the tricky one, Karen. This is the tricky one. As in most situations, you have prepaid for your Part A, so you probably want to go ahead and enroll in it. The exception is if you have an HSA that your employer contributes to. It gets tricky because you can't continue to get funds in that HSA. This is a tax rule, not a Medicare rule. If you're eligible for that Part A. So it gets a little bit tricky. We can definitely explore that one-on-one if you're in that situation. But if you're not contributing, your employer's not contributing to an HSA, then yes, 99% of the time, I'm going to say go ahead and take that Part A because you've prepaid for it. usually your insurance company is going to want you to take it. And so the Part B is the one you're going to delay because you would have to pay monthly for it. But your Part A is the one you're going to go ahead and take. And you can enroll in that pretty much any time because you have that group coverage. So you're fine there. You have that credible coverage. But yeah, you can enroll and have it start on the first day of the month of your 65th birthday.
Okay.
Did
And
that answer the question?
I think so. I'll have her, I'll have her make a note if it did not. But then,
Please, yeah. It's a little tricky, yeah.
and
Most of the time, yeah, you're gonna wanna go ahead and take that Part A.
Nancy and
I'm
I,
not gonna yeah, go ahead.
we dealt with an HSA problem earlier this year, so that was a challenge. But then we do have one last question, and that is,
Perfect.
can you change your Part D plans during the open enrollment?
Yes, the open enrollment time is the time that you have that opportunity to change your Part D plan if you want to. It's the time to no matter what, I want everybody on Part D to review their Part D plan. You have lots of different ways to do that. You can simply go on medicare.gov. You can talk to a local agent. You can call your plan. You can go to a plan's website. You can call 1-800-Medicare, and you can call us. We're happy. That's what we do. We right now, this is our busiest time of the year. We spend all day usually in communities, meeting one-on-one with people. And then this year, we've met with so many people over the years, and this year we're doing it a lot of times via Zoom, just over the phone. A lot of people don't have computers even, so we're mailing them everything, showing them the comparisons, and then having them call us when they get it. But yeah, we're being creative this year because we're used to meeting with people in person. But yes, this is your opportunity, and it's really simple. Honestly, our wait times are today. I will say that maybe they were longer than usual. We seem to have been very, very busy today. And we were all just taking calls as quick as we could, but we answer those calls in-house, so they're not, when you call our 800 number, it's not farmed out to a call center. They go directly to us, and you can leave a message, and we normally call you back same day. Our voicemail will say within 2 days, but we always try to return call same day. If you do have to leave a voicemail, or you'll get somebody live. Your wait time in the morning we really won't have one, and we get busy usually after about 9 a.m. and it goes right until about 4 our time in Pacific time zone. And you're gonna get us on the phone, and normally we're gonna either schedule you an appointment with one of our counselors to talk over the phone, or we're just gonna help you right then and there while you're on the phone with us and help you review your plan. You can be on the internet with us. You can just call with questions. We can even just go on medicare.gov, put in your prescriptions real quick, and you can tell us what plan you're on, or we can look it up, and we can make sure that that plan is going to work for you for the next year.
Okay, thanks,
So it's
Ann.
a long way of saying yes, yes, yes. You absolutely can, and I encourage you to do so.
We actually have some amazing Medicare counselors down here in Moscow, so definitely get in touch with them.
Yeah, we do. And that's we coordinate their schedules. Normally, I mean, if they gave you their own number, then that's up to them. But we coordinate. If you call us, we'll get you an appointment with a counselor. This year we have a lot of statewide counselors, so um, we try to get you with somebody local. But you might be talking to we're just doing everything we can to provide services to everybody this year in a little bit way of something we weren't counting on, and we switched the way we did things once we found out we weren't going to be able to do in person. But normally I'm on the road all the time this time of year, so this is a change. You probably have heard of the donut hole or coverage gap. I'm going to tell you, it sort of closed in 2020. It closed as much as it's going to close ever through the Affordable Care Act. So it's definitely gotten much better. But only 20% of Medicare beneficiaries fall into this. And usually it's folks that are on the insulin, who I talked about earlier with that insulin program that's available through some plans. And then I talked about some of the programs that might help you with your Part D expenses, but they're going to be people who are on fairly expensive name brand medication, insulins, things like that. So most people don't fall into it. And if you're somebody, it affects people drastically who fall into it, but a lot of people don't. It's also known as the donut hole, who I think most of you have probably heard of that. But if you think you're somebody in that situation, let's again review your plan and make sure that you're going to be best as you can be off dollar wise for the 2021 year. And then again, I told you I'm going to refer back to this chart lots just to kind of refresh your memory of where we just went. So we talked about original Medicare, we talked about A and B, and adding a D plan and a Medicare supplement with it. So we've covered that. Now we're going to talk about your option to combine everything together into one plan. These are health plans that are approved by Medicare, and it's a different way to get your Medicare coverage. So it's a completely different way from this side to get your Medicare coverage. Sometimes they're referred to as Part C. I don't like to refer to them as that because I don't think A, B, and D adds up to C. So I don't refer to them as that. And most of the time in your Medicare books and things you get, they call them Medicare Advantage plans or Medicare health plans. So they are approved by Medicare. They're sold by private companies. So you might have Blue Cross, you might have Regents. If you're in Latah County, those are the two companies that sell a variety of different plans. In other counties, you might have Blue Cross, Regents, United Healthcare, Humana, Aetna, Pacific Source. And if you're, maybe down south, you would have some different options. But these are private companies that basically are getting paid by Medicare to administer your Part A, B, and D coverage. You still pay your Part B premium, that doesn't go away, but then you pay another usually small premium to the Part C or Medicare Advantage plan every month. And then you get some additional services as well. So you're going to get usually some dental, depending on the plan you're on, some vision, some hearing, some over-the-counter benefits where you can order supplies out of a catalog every quarter or out of an online service. They're structured a little bit differently. These are going to be HMOs or PPOs, and I talked a little bit about that. So they're going to be health maintenance organizations or preferred for provider. So for example, if you are looking at a Medicare Advantage plan, first thing I'm going to ask you is what doctors do you go to? Let's make sure they're in network. Because if you want to continue going to those doctors, you probably want a plan that's going to cover in that, be in the network. Because that doesn't work well for you. Again, I'll probably ask you, do you travel a lot? A lot of these will have some small travel benefits with them, and they're becoming more creative how they offer those. So they're getting more, like I said, more advantageous as the years go on, but they are just structured completely different than your original Medicare. All of your services are administered by a private company. You do get the same rights and protections that you would have with Part A and B. You are still part of the Medicare program. Your Medicare is being managed by a private company. Every year, you can review or join a Medicare Advantage plan again during this open enrollment period, October 15th through December 7th, or when you initially go on Medicare, that's your opportunity to enroll in one of these as well. If you don't want one, or you just take A and B and D, and then you think, well, maybe I want to do a Medicare Advantage plan. Right now is that opportunity, or like I said, when you first go on those plans. So again, I'm still talking about the Medicare Advantage plans. And again, I'm going to provide you, or Karen's going to provide you with a printout of this in case you just want to have some late night reading. But many plans will include some dental, preventative, and comprehensive. More in 2021 than in 2020. That over-the-counter benefit, the vision benefit, the hearing aid benefit. There's plans available that are, there's, for example, plans available in Latah County. There's a Blue Cross plan available that's $23 a month. Seems pretty good. They're structured differently. So, for example, with that G plan we talked about, if you did A and B and then a G plan, the only out-of-pocket cost you would have is that Part B deductible of the $198. So, comparing apples to apples, if you had a Medicare Advantage plan, you would pay for the G plan, you're going to be looking at, I want to say, an average of probably, as a new to Medicare, you would probably be paying around 160 to 180 a month for that G plan. And then for a Medicare Advantage plan, you're going to pay quite a bit less per month. But you're going to have copays each time you go to the doctor. So if you go to a primary doctor, your copay might be $5, $10. And then when you see a specialist, it can be anywhere from $35 to $40, maybe $45. When you get physical therapy, you're going to have a copay. And then with that G plan, like we were talking about, you would just have that one annual deductible, and then it would be covered at 100%. So they're just structured differently. With the supplements, you might pay more per month in a premium and have less copays. If you're in a Medicare Advantage plan, you would pay less premium monthly, but possibly have more copays. So they're just structured completely different. And people say, well, what do you think the best thing to do is? Well, it's never for me to answer because I don't know your healthcare needs. I don't know your financial needs. You know, I'm not your financial advisor. Some people are very comfortable having copays. It's just like having, a different deductible on your auto insurance or your homeowner's insurance. We're all different the kind of risks we like to take. Some people like to have full coverage on their paid off car, and some people just like to have liability. Because the more comprehensive you get, the more higher in premium you pay every month. This is your health care, so it's a little more important, and it's great to be educated about this when you're on Medicare, because this can affect your finances and your health. So just be really aware of what you're on and what the potentials are. When you're on a Medicare Advantage plan, you do have a maximum out of pocket. So if you're just on A and B, you're not going to have max out of pocket. So there's never going to be a ceiling. You're going to pay if you just have A and B and not a Medicare supplement, you're going to pay your deductibles and your 20%. But there's never going to be a ceiling if you have major surgery from, February to October, you're not going to hit a max out of pocket because there is no max out of pocket protection with original Medicare. With a Medicare Advantage plan, you are going to have a protection. The plans are a little different. They might be $5,500, $6,000. It just depends on the plan you're on, but you are going to have that protection. And that, at least gives you that knowing, okay, worst case scenario, my copays are never going to come up to that dollar amount. It would be awfully hard for them to, you would have to have a lot going on for them to come to that dollar amount. I don't talk to many people who meet that max out of pocket. Because that Medicare Advantage plan is going to, pretty much cover you with some limited copays. So, for example, you might pay, if you have a Medicare Advantage plan, you might pay $325 per day if you're an admitted patient in a hospital. So if you're in the hospital for 2 days, your copay would be $650. Still better than the $1,400 with original Medicare. Things like that, but those are great. This is your opportunity to review that and determine, if that's something you want to do. And so any questions as far as that goes? So I'm just going to highlight this. The original Medicare is the A and B, and then it's your choice if you want to add things to it. The Medicare Advantage or Part C combines everything together into one plan.
So
Yeah, go ahead,
if
please.
if you choose the original Medicare, And then you decide that you want to go to the Medicare Advantage afterwards. Can you do that?
Yes, you can. You can do that any time
Can you go the other way?
during the open enrollment period, which is October 15th through December 7th.
Can you go the other way? Can you go from Medicare Advantage to original Medicare?
Yes.
Okay.
Yeah, so this if you're on a Medicare Advantage plan and it's not working for you, this is your opportunity to drop it during October 15th through December 7th, and then you would make the decision if you want to enroll in a standalone Part D plan. Here's the tricky part. The tricky part is if you're in original Medicare or a Medicare Advantage plan and you do not have a supplement, you wouldn't necessarily have a guaranteed issue right to buy that secondary insurance because you've missed that open enrollment window when you first went on Part B.
Okay.
That's the tricky part. Going back and forth, basically from original Medicare to Medicare Advantage or Medicare Advantage to original Medicare, you can do that pretty easily. The tricky part is the supplement. That is the tricky part because you don't. That's why it's good to make a decision when you're first eligible for Medicare. There's some special circumstances. For example, if you were to move from Idaho to a whole different state and you are on a Medicare Advantage plan and that Medicare Advantage plan is no longer available to you because you left the service area, then you would have a guaranteed issue right to buy a Medicare supplement plan. Or if the plan decided not to do business in your county anymore. So if a plan was leaving the area and you were in that plan, you would have the opportunity then to buy a Medicare supplement. But in most situations, the best time to buy a supplement is when you're first initially eligible for it. So that is when your Part B starts. That is the most advantageous time. If you don't buy it during that 6-month open enrollment period when your Part B starts, and again, it depends when your Part B, your Part B can start when you're older because most people work past 65 and then they have that group coverage. So you don't have to take it right when you're eligible for Medicare. It's that Part B, but if you do take Part B and you still have that group coverage, there's some other times you can buy it because you have the group coverage. But if you just have A and B, you would have to go through medical underwriting. So it's not saying you can't get it. I'm just saying you would have to go through medical underwriting to get a plan. So like I said, that's where it gets tricky. That's where it gets really tricky. Hopefully that answered your question.
Perfect. Thanks, Angie.
Medicare offers a lot of preventative services as well. So they offer the annual screening, annual health screenings, cardiovascular, many things. I always encourage people to use these because these are usually available without any copay, no matter how you get your Medicare. Because preventative services save the healthcare industry money. What does Medicare want to do? Save money. And even if you're in a Medicare Advantage plan, no matter how you receive your Medicare, you're going to be able to get most preventative services, colonoscopies, um, many things without any copay because they want you to get them because it's ultimately going to save money for the Medicare system. So I always try to talk to people a little bit about that. The flu shot is covered too. Um, that will they believe that that's a preventative measure. Definitely this year, it's your personal choice if you want to get the flu shot. People have various opinions on it, but they definitely are encouraging you through the Health and Human Services to get this, especially with the COVID, because it could be the same symptoms, or you could have COVID and the flu at the same time, and that could obviously not be fun. But that's personal choice. But I just like to let people know it is something you can get with your Medicare. We also try to help people prevent fraud. This is just a little ad that Medicare came up with. I social distance from scammers. just kind of trying to make a funny on it, I guess. But it's basically just letting you know, if you get a call offering you COVID-19 items such as a test kit or mask or antibody tests, things like that, you do want to prevent yourself from that fraud. Definitely. If you wanted a COVID test or felt you needed one, that's between you and the health district or your healthcare provider. Um, People should not be soliciting you. The antibody tests really have not been approved yet. Definitely not approved by Medicare. Once they're approved and things like that, then your Medicare would cover them if and when they're approved. But I'm finding that in bigger areas, even up in Coeur d'Alene, there's a lot of scams going on, saying, "Hey, you can get the antibody test. We'll bill your Medicare. Your Medicare will pay for it." Well, really, what they're doing is they're not taking any antibody tests. They are getting your Medicare number and billing, and then by the time Medicare catches up with them, they have pulled out of town. So it's impossible to catch up with these people. It's just fraudulent billing. Check your statements you get. So you can get statements online from Medicare.gov if you choose, or they'll mail you statements if you're in original Medicare every quarter. You get an EOB, which is an estimate of benefits for Medicare Advantage plans or Part D plans. If you have questions about fraud, certainly feel free to reach out to us or Medicare. We definitely encourage you to do that so that we can know about it and do whatever we can to help you. There are programs, as I mentioned, for people with limited income. I just like to talk about it because a lot of people are eligible for this and don't take advantage of it. We do help people apply for Medicaid in many situations. Your Medicare isn't going to cover you. Um, Basically, your Medicare Advantage plan or your original Medicare or supplement is not going to cover you for long term care. So it will cover you if you need to go to a skilled nursing facility for rehab, if you have surgery or are sick and just need to rehab for a little while, but it's not going to cover you for memory care or to get skilled nursing care if you're not improving. It's only going to cover you for rehab. So skilled nursing is insanely expensive, can be anywhere from $8,000 to $12,000 a month. If you don't have a long-term care policy, it would be private pay. Once your income gets down, then there's Medicaid that can help you cover those costs. It can go quick if you're in a skilled nursing for a while. Some of the key points to remember is that Medicare is health insurance. Medicare is not going to cover all of your healthcare costs. I mean, there's going to be premiums with it. It's not free. It's not a lot of people are frustrated because they feel like, well, gosh, I've paid into this all these years. I didn't realize I was going to have to pay a premium for it. I didn't realize I was going to have these co-pays. It's challenging, so it's a good if you're learning about Medicare or you're just getting updated about it. There are different ways to get Medicare. You can get original Medicare and add things to it, or you can do the Medicare Advantage plan. There are programs for people with limited income and resources. Definitely get help. Get help with your Medicare decisions. There's lots of resources for you. Local agents are awesome, or an agent in general that you trust and have a relationship with. I know we have a lot of good agents here in Idaho that are definitely looking out for your best interest. But you want to make the right decisions for your circumstances, make them at the right times, because as I talked about, it's not always easy to switch back and forth in certain situations, and get help if you don't understand your Medicare or it doesn't make sense, or you want to talk about your specific situation. Our program is an extension of Medicare. We technically are getting paid out of just the federal government money primarily and state money. So we have very close relationships with the people at the Centers for Medicare. We have key liaisons and contacts, and in many situations I'm relaying on them, say, help me interpret this law for somebody, or referring cases to them that are not processed the way we think they should be. But we're definitely here as a resource for you. We do not charge for our services. They're 100% free. We're confidential. We're not going to share your information with anybody. We go through any of our counselors have to go through a pretty stringent background check to be a part of this program, and really stringent training. They have to take annual recertifications. We shadow them. It takes a long time to learn this job. And so, in a lot of training, like I said, I'm going on 13 years of being with the state, and I've been with this program for over 6 years. So it's been, I learn, I can't tell you, I really honestly, I went right when I think I know all there is to know, or I've heard it all, something crazy will come up. So I'm always looking at laws and regulations and things like that. And then if you are with one of our counselors, many of them are volunteers, and we are supporting them and offering them updated training. And like I said, they do go through a really stringent training. But if you are by chance interested in becoming a volunteer for us, gosh, don't hesitate to reach out to us. We'd love to have you. If you're new to Medicare and you want to learn a lot about it, this is a great way to do that. That's how most people end up becoming volunteers for us. So this is our website. This is the Idaho Department of Insurance website, where we do offer the Medigap rates. Those are regulated by us, by the Department of Insurance. And then it gives you lots of different resources. If you were looking for Sheba, it would be this right here. This is the Sheba site, but you can Google Department of Insurance Sheba and certainly get here. Your Medicare.gov site is going to be great. And of course, call 1-800-Medicare. Call us if you need help with that. Your agent is a great resource for you. 1-800-Medicare. You will definitely be on hold less time during the day with us than you would with 1-800-Medicare. So feel free to call us. Like I said, if you leave a message, we do say on our message that it's up to 2 days, but even today it was crazier than ever, and we returned every call today by 5 o'clock. So we're doing everything we can possible to get back to you same day. And we can set up an appointment, spend more time with you one-on-one, or help you right then and there. But that's our number, the 247-4422. And again, that gets you right to a Sheba staff member. And it might be across the state, but everybody's very familiar with what's available in every area. We did a lot of cross training this year just to be sure that we could cover everybody. But again, we do have a lot of information. We offer these workshops. I do this through Karen a couple times a year. We used to do it in person, and then since March, we've been doing it remotely, and it's worked pretty good. We've always have a great crowd, and I really appreciate Karen putting these together for us. But if you think, gosh, I need another one of those, that's okay too. Or if you want to, sit down and go through things one-on-one, do not hesitate. That's what we're here for. Definitely use your resources. So we're happy to help. But with that, I think I kind of wrapped it up. I do want to touch on, since we have a little bit more time, I was running out of time on a lot of these because I get a little chatty explaining things, but on the Medicare.gov, on the Part A and Part B, again, if you're receiving Social Security, you will automatically be enrolled either a couple months before you're eligible if you're under 65. If you're turning 65, you will probably receive that card a couple months before you're 65. If you are not receiving Social Security, the only way you get that Medicare is by taking action. You have to do something. So again, all of the Social Security offices are not taking walk-ins or seeing people in person. So you have to do it over the phone, or by creating an account, or by mailing in documents. And if you need any help with that, we have it. We can get it to you, either by mail, email, whatever the case is. We're happy to help with that. But yeah, if you want Medicare and you're not receiving Social Security, you have to take action. If you are receiving Social Security and you think, gosh, I did not receive my card, maybe the Social Security doesn't have your current address on file. That could be a reason. Or maybe you got it and it was, in a package that wasn't recognizable, or along with all the other mail you're getting right now because everybody else knows you're going on Medicare, it got lost in the shuffle. That can happen too. But yeah, I'm happy to answer any questions as we wrap up here. Or definitely, if you want an appointment or you need to talk to somebody, just definitely from Pacific time, our helpline, that 800 number, is open 7 to 4, and Mountain time 8 to 5. But you can call after that and after or before that and leave a message, and we'll get back to you as well.
Angie, why don't you go ahead and quit sharing your screen? And then
Perfect.
if anybody has a question, you can go ahead and unmute yourself and just ask her. And if you want to raise your hand or whatever you want to do, however you want to do it, um, I think that as long as we see you're unmuted, we'll know that you want to talk. This is a really good time. Don't take off and leave us quite yet, because somebody else's question will probably be your question that you have, or you might even not know that that was your question.
Yeah, very good point.
So definitely. And then for my folks that are in Washington, if you have questions about Washington Sheba, I have their
Thank you.
email address as well, or their web address. So I send me a note and I will be glad to get that to you. I did send you all of Angie's handouts about 10 minutes before the the presentation started. So if you didn't get those yet, they go check your email and I'll be glad to send those to you again as well. So I will turn it over for questions, and just go ahead and ask your questions. I see that Tuck um, has unmuted, and so go ahead if you have a question.
Thank you. I hate to ask my question here because it's not going to pertain to other people, but for me, I'm 66, will be 67 in January. I am on Medicare Part A. I've been trying for 2 years to get on Part B. It has been an absolute nightmare. I cannot get into my Medicare account. I need somebody like you who can guide me through. Every time I call them, they come up with, oh, we found the problem. Yep, we're going to fix it. Then, and then I go to the doctor and the bill doesn't get paid, and the doctor gets angry and I pay the bill. And, and finally, with like the fourth or fifth call, they just said, well, you're just out of luck. And when
Oh,
the open
okay.
enrollment comes around,
Tuck?
get back on it. But quite frankly, I have no confidence that I'm going to be able to sign up on the open enrollment. I've signed up twice, and I don't get any bills paid. I've been paying for Medicare supplement, but
Oh
obviously
my goodness.
I
Yeah.
don't have
We
any insurance, because since I'm not on Medicare B, they won't do it. I'd like to get that money back since they're not giving me insurance, but I'm sure they're going to tell me I'm out of luck. I really need some help.
Perfect. I'm going to give you my direct number, and give me a call. I'm on the phone pretty much all day, so you may very likely get my voicemail, but I will call you back. If I can't call you same day, I will call you next day, or if it's a weekend, I'll call you on a Monday. But my direct number, and I have no problem with that. I would love to help you. It's 208 664 5480, and that's exactly what I'm here for. And I can work directly with CMS and Social Security, and hopefully do whatever I can to get that resolved for you and see what the heck's going on, all this time.
Thank you so much.
Are you in Idaho? Just to verify, you're in Idaho, correct?
I'm not. My wife is in Moscow. I am in California. I did stop by the Social Security office in Lewiston after the first time that I found out that they weren't paying doctor bills to get signed up, and I gave them, I don't know, $1,000 or something because
Okay.
they said they hadn't
What's your
gotten my money.
resident? Are you an Idaho resident?
I am a California resident. So I am in transition, in the process of retiring to Idaho.
Okay. Give me a call. I'll see if I can help you. Otherwise, I'll get you to the California office. They have an office similar to what I do, and I can see what I can do there. We'll see if we can get you passed as an Idaho resident and see if I can help you. Okay.
Super. Thank you very much.
You bet. So yeah, if you have problems with your Medicare, whether it be enrolling or Medicare not paying something, that's what we're here for too. We're your local people who take local representatives for Medicare who take those complaints. You can certainly file directly with Medicare, but you can certainly file with us too. And we have policies and procedures. And if we can't get it resolved, then many times we do have to refer it to Medicare, but we have a direct caseworkers in the Seattle office who we work with who usually are great on helping get things resolved.
Super. Thank you very much.
You bet. And again, if you are on Part D or a Medicare Advantage plan, I encourage you to review that. Or if you're going on Medicare, going to be new to Medicare, this is your opportunity to look at, you have that opportunity to look at all your options here. And that's important because these decisions you make when you initially go on Medicare are going to affect your finances and your health. And those are, really important things. So we want to make sure that we're doing everything we can to help you make help you understand what the best decision might be for you.
Do we have any other questions?
I have a question.
Go ahead.
Great. Go ahead.
I'm a Social Security. I received Social Security. I retired early before, and I started withdrawing at 62. I pay into a Blue Cross Blue Shield federal health insurance. Do I really need Part B?
It's totally up to you, which is tricky. We can review. If you're on the Blue Cross plan and if you've been happy with that, it's definitely up to you don't. It's tricky. It's one of those tricky ones where you're not going to be protected. If you want to take Part B later, you will pay a higher premium for it. So it's not necessarily that you need it or don't need it. It's just more of a matter of if you think, if you feel confident you're going to be taken care of through that federal policy, then that's fine. If you ever do want to take Part B later, just if you don't take it when you're initially eligible, just be aware that you would pay a higher premium for it.
So Part B is pretty much the same as having your own private insurance already. Like for me, I have, if not necessarily Blue Cross Blue Shield, I can have any insurance. I pay for that still.
Mm-hmm. You do. Yep, you do. So it depends. Depend on what plan you have. The federal has quite a few plans. I've done quite a few reviews on those with people. It just depends. Some people take Part B, some people don't. Sometimes your cost will be covered, your out of pocket will be covered more with taking Part B. But it just depends. Unfortunately it's not cut and dry, but I would be happy when you're eligible for Medicare, we can absolutely review that plan. Some of the federal plans available, if you take Part B, then you pay a lower premium for that federal retiree plan. So sometimes it's a benefit to take it, or sometimes some of the federal plans will actually, if you take Part B, they will give you somewhat of a reimbursement on your Part B expenses. So maybe they'll give you up to $1,200 a year. So then taking your Part B really, it would cost you a little bit, but not a lot. But you know what? If you're in Idaho, I'd be happy to review that with you. But on the federal, I can't think of what it is, the group website, you can definitely put in your zip code and review all those plans available, and then it should tell you. But again, I'm happy to look at that with you as well. If you're in Idaho, and if not, you can probably reach out to your state's department like ours. But it just depends. It's not a yes or no, unfortunately.
Well, I'm covered now under Part A and B because I'm within that 3 month before my birthday.
So they automatically enrolled you?
Yes.
Mm-hmm.
So I don't want to double pay if it's the same thing.
Nope, exactly. So it'll just depend. Again, it will depend.
Well, I don't want to take
It will.
everybody's time. So I
Yep,
can
but
give you the
yeah,
best.
yeah. Please do. Please do. Yep, I'd be happy to look at it with you for sure.
So I just call it 800-247-4422.
Yep, just give that number a call, and if whoever answers, not everybody's really well versed in the federal plans. Let me just see. I always like to give my number out because I love helping everybody I talk to. Just give me a call. I'll be happy to look at it with you. I think the federal open season, isn't that coming up fairly quickly too?
Yes,
Or
yes, it
yes,
is.
okay. So definitely just give me a call, 208-664-5480. And when can you tell me when your Medicare starts? How soon? Or did
January
it already?
3rd.
Perfect. Okay. Yep, give me a call. We'll definitely look at that before
Okay.
just,
And my
before.
husband, he's under the same plan. I pay for his insurance also because he doesn't have insurance. So his starts December 12th.
And he enrolled in the Part A and B?
Well, the Social Security did.
Oh, because he received Social Security. Okay. Yeah, just like I said, just give me a call. We'll make time to visit and
So
look at
really,
that
he
for you.
should be making a decision before November 1st, right? To be covered in December.
Um, Not necessarily. I mean,
Oh,
he could, if he decides he wants to disenroll from Part B, he can do that
okay. Okay.
during the month of November. Yeah.
All right. I'll give you a buzz. Thanks.
Perfect. Thanks, Donna. Look forward to talking to you.
Okay.
Well, I thank everybody for joining. Lots of information. Don't feel like, if you leave a little more confused and you're like, oh gosh, that was so much information, that's okay. I mean, Medicare is not something, you learn everything about it in, an hour and a half or 2 hours. You learn more about it as you go on. The most important thing is if you just, reviewing your options and knowing that you do have resources to look at your options. Just like, Donna had mentioned, gosh, oh my gosh, all of a sudden I'm realizing, gosh, do I want this Part B? Do I want to pay that premium every month? It may be a situation where it's in her interest, and there may be a situation where it's not going to benefit her. So we'll look at that individually, and I'll just help her know what her options are, and that's what I'm here for. I'm happy to do it.
Well, Angie, thank you so very much for
Thank
coming
you.
tonight, and we appreciate it a great deal. Your presentations are always excellent. We are recording this presentation, and I can tuck it up on my Latah County Extension webpage. So if anybody wants to go back over it and look at it, there is already one up there. So the only thing that I tell people is be really careful, because when you go up there, everything changes. And so
Mhm.
I will probably be pulling that one down and put this one back up there, because the new things come up for the year and everything. If you have friends or folks that are getting ready to retire, or you just want to ask some more questions, Angie and I do these presentations 3 times a year. And so the only problem is I can't bring you cookies and coffee, so you'll have to do that yourself. But as we leave today, please pack up your chair and put it away.
It's a little easier. We were
It
just
is.
saying yeah, I miss the in person though. I really do. I really like, that's the one thing I really miss being with people. It's nice to be I'm glad I'm able to do this, but being with people is definitely something our staff is all missing. Just, that human interaction. And it's a lot harder for, some folks to understand this, this way than it is sitting with them and pointing and showing and highlighting. And so it's hard, but we want to keep everybody safe as well. So
Well, and the struggle is real for me because I hug people. So it's
I'm a people person. I know. I know.
So this is actually better that I'm in my own space so that I'm not hugging everybody. But yes, so definitely if you have any questions or anything, don't hesitate to reach out and get in touch with us. I have all of Angie's contact information too if you need that. And if you have any questions, we're here to help. So
Yeah, and all year. It's not just this one time. I mean, I'm employed with the state all year, so we deal with Medicare all year long. So this is just an extra busy time and great. So
alrighty, guys, we'll let you go then. Have a lovely evening and we will see you next time.
yeah, thank you. Enjoy your evening, everybody. Stay warm. Hopefully that snow melts.
No kidding.
Bye-bye.
We
Thank you,
were
everybody.
50 this weekend, so I
Thank you
think
for thank you for a great program.
Thank you. Thank you, Karen. Karen it
Thank you.
coordinates this, so that's awesome. Thank you, Karen.
Thanks,
absolutely.
Karen.
You bet. You guys have a great evening.
Bye-bye.
Bye.
Bye-bye.